Hello, this is part two of our lecture on cytomegaloviral infection in pregnancy. So, we will discuss how to investigate if we suspect cytomegalovirus. First is serology. So, serology can be tricky, and as always, there are two main types of antibodies which we have to do. First is cytomegalovirus IgM, and the second one is cytomegalovirus IgG. As always, cytomegalovirus IgM indicates recent infection, but it takes some time, right? It does not happen in one day. So, but still, if we detect IgM cytomegalovirus antibodies, it means there is recent infection. Okay. However, if it's only the IgG cytomegalovirus IgG antibodies are positive, that means the person has been previously infected. Okay. And now the body they have developed antibodies against cytomegalovirus. Third situation is maybe both IgM and IgG cytomegalovirus antibodies may be positive. So that means, yes, there is a recent infection, and now the body is developing antibodies for long-term immunity. Okay. So, and the last one is both IgM and IgG antibodies for cytomegalovirus are absent. So that means the person previously was never infected with cytomegalovirus, and currently also they do not have antibodies. So most likely there is no current infection. Now the problem is how to differentiate between this IgG only and IgM and IgG, because see, basically, even this IgM, yes, it means recent infection, but even this IgM takes some time to develop, right? It does not happen in 1 or 2 days, okay? So the best test to detect whether it is a recent primary infection or not, we have to do these tests. Once we do them, is the IgG avidity assays, okay? Avidity basically means the bonding strength, right? So it measures the bonding strength between the antibodies and the virus, the IgG antibodies and the virus. So it's the IgG avidity assays, okay? The idea here is if the antibodies are old, like it has been some time since they were produced, like in this situation, in the second one, like it's an old infection, right? So we basically want to differentiate between this and this, okay? If it's an old infection, the strength between the IgG antibody and so it will be high, okay? So basically, and if it's a new infection, they will have low binding strength, so it's low avidity, okay? So following primary cytomegalovirus infection, IgG antibodies have low binding strength, which is low avidity. Then over 2 to 4 months, they mature to high binding strength, high avidity, okay? So basically, it's to help distinguish a primary cytomegalovirus infection from a past infection, okay? So between this and this. So this is a very important test, but again, so first we will do the serology, and then if it's either of these, then we have to do IgG avidity test. Now, for the fetus, how do we know? Okay, the mother is infected, right? But how do we know whether it has infected the baby or not? Because a lot of times it happens that the mother is infected, but the baby is not infected. The baby may be exposed, but baby is not infected. How do we know that? Again, so any case, all infections, I'm telling you, where we have to confirm, we need fetal medicine, okay? Those are obstetricians, that's a subspecialty, but they may need to do invasive testing. So for this one, it's amniocentesis. Okay, so amniocentesis is taking a taking a sample from the amniotic fluid around the baby under ultrasound guidance. It's of course invasive, it has side effects, but I'm not going into that. So if fetal infection is suspected, and basically what does it do? It detects viral DNA from amniotic fluid. Now the problem here is if it's not 100% reliable, but still it adds, right? So a better test may be doing chordosynthesis, but that's more tricky. It's more dangerous compared to the more side effects compared to amniocentesis. So viral DNA by chordosynthesis, but there is comparatively high risk of fetal loss compared to amniocentesis. And see, it's direct taking a blood sample from the umbilical cord. Okay. Now, if amniocentesis was taken, and then they can be sent for examination under the microscope. And the characteristic feature is the owl's eye appearance, or they're called intracytoplasmic inclusion. So if in MCQ or in any report, if you see intracytoplasmic inclusions, that means actually that it's cytomegalovirus infection. Okay. So for the baby, even on ultrasound, even before birth, fetal brain, if ultrasound is performed, there are now two terms. We already knew about intracerebral calcifications, right? So intracerebral calcifications are also present in toxoplasmosis. The main difference is in toxoplasmosis, so the cerebral calcifications are spread all over the brain, right? In cytomegalovirus, they are more around these ventricles, brain ventricles. Okay. And now there may be periventricular leukomalacia and there may be intracerebral calcifications. They are not the same terms. Okay. So basically, periventricular leukomalacia is brain injury which causes softening of the white matter of the brain because of lack of blood flow. And intracerebral calcification simply means that it's the deposition of calcium in the brain. Okay. So these are two different terms, but both of them are seen in periventricular leukomalacia and in intracerebral calcifications. They are present in cytomegalovirus. Okay. So what is the treatment? Primary maternal infection. Okay. Primary maternal infection is more dangerous than reinfection. Remember, we said that there is a latent phase and then it can be activated, especially when the patient is immunocompromised. So that's reinfection. So if the patient gets it for the first time, primary maternal infection is more dangerous than reinfection. Okay. Because in reinfection, at least she will have previous IgG antibodies. Infection early in pregnancy is more damaging than later infection, as all infections, right? In for early trimester, because baby's new cells are being formed, so it's more damaging. Currently, unfortunately, there is no vaccine available, and once it is infected, there is actually no fetal therapy. But this medicine, OBGYN cyclovir, temporarily reduces shedding of virus and may help in reduction of audiological complications of cytomegalovirus, which is the most common complication of congenital cytomegalovirus infection. So, what is the most common complication of congenital cytomegalovirus infection? It's sensorineural deafness. Okay. How about breastfeeding the baby? So, if the mother is infected with primary infection, okay, there is it's excreted in breast milk. Okay. But always we have to weigh the risks and benefits. The amount is small actually, which is transmitted through the breast milk. So remember that if you're not sure about breastfeeding, there are only very few situations where breastfeeding is contraindicated. For example, if the mother is active tuberculosis, right, and if she's not on treatment, for example, or if she has HIV, right, with high load, viral load, like there are very few contraindications for to breastfeeding. So most of the cases, it's encouraged. Women are encouraged. Okay. So breast milk, breastfeeding, that's not contraindicated because it also provides IgG to the infant. Okay. So that's it about cytomegalovirus infection. If you have any questions, just drop a